Hi everyone, this is Sean with the MassSupport Network here with your COVID-19 update for Friday, January 29th, 2021. A lot to cover today, but most of it is pretty good news, so let's get to it. Around the world and here at home, case counts are falling, or at least the rate at which case counts are increasing is falling. The world saw 3.9 million new cases in the last week, but that's 600,000 fewer cases than the week before. Here in the United States, we saw 1.2 million, which is about 200,000 fewer than the week before. And here in Massachusetts, we saw about 28,000 new cases, and that's about 6,000 fewer cases than we saw last week. Now, while case counts are falling, deaths are not just yet. Deaths tend to lag behind cases by about a month or so. And worldwide, we saw nearly 100,000 deaths in the last week, an increase of about 21,000. In the United States, 23,000 people died from COVID-19 in the last week, which is an increase of 7,000 deaths. And here in Massachusetts, 442 residents of the Commonwealth passed away from COVID-19, which was 107 more than we lost the week before. So looking at everything graphically, you can see how just about everything except for deaths is on the downward trend there. When we look at things week by week, we can see that in terms of cases, last week was the lowest it's been since early November, basically. Also with hospitalizations dropping there as well. For deaths, though, it was the second deadliest week of the pandemic, unfortunately. Now, some of this may as well come from the lag in death reporting, as deaths do take a while to come through sometimes. So some of these may be from earlier weeks, as is always the case, but still a lot of people dying right now. But everything else is at least trending better. Particularly with cases, as you can see around the country, basically every region is steadily declining at this point in terms of cases. This looks at the census regions by million people. And for example, the West there, this chart looks like it's in basically free fall there, which would be great. Getting down to many regions to the West is basically pre-Thanksgiving levels at this point. The South is declining a little more slowly, and of course, as the largest region, that's the most territory there and going to be the largest number of cases. Midwest is continuing its fall that's been going on since it peaked back in November and is getting very low now. Here in the Northeast, we are still pretty high. By population, we have the most cases right now. But we have dipped back down to a point where I believe that's the Christmas data irregularity there, but still trending downward, which is great. It would be great if we were going a little faster here in the Northeast. In terms of areas, these two graphs here on the left shows the counties in the United States that had more than one case per 1,000 people. Generally, we give the numbers of cases per a population as per 100,000 or per million. So having one per 1,000 is quite a lot. And this shows on the left where things stood on December 20th, with 515 counties having more than one case per 1,000 people. And then on the right, we see that it's almost half as many at this point currently, which is pretty great. You can see where a lot of that reduction has come in the Southwest, in the middle of the country, especially in the South there. Up here, though, in Massachusetts, you can see that it's still kind of the same there. I think there's maybe one county that's dropped off there. That might be Bristol County, might be part of Rhode Island. It's hard to tell at this scale, but we haven't changed that much. There's still that greater Boston out to what appears to be Worcester there, still showing those same levels. And today's MassSupport, public health report for Massachusetts, we will more at that. But in terms of hospitalizations, basically every state in the country had a reduction in hospitalizations in the last week, excuse me. The only state that did not was Vermont, which has so few that a net gain of one hospitalization, one additional patient in the hospital bumped them up 2%. But so this is right. And so again, these are percentages right now. So when we actually look at these in absolute values, we can see how many people are actually leaving the hospitals. This is just showing from the 27th to the 28th, just a single day's change in hospitalizations. There are a few that went up. Any day can have some swing, but you see like California alone, over 500 fewer patients in hospitals right there. Massachusetts, we're squarely in the middle. That day, 52 people net discharged from hospitals. Of course, people are going to be coming in every time, so it's not like it's just a pure exit, but that does mean there's actually more people discharging than coming in. In terms of deaths, however, most places, though, those are still going up or holding steady. The Midwest is still declining, and it looks like maybe in the Northeast we are. It's kind of up and down a little bit in the last couple of days. The South and the West are still going up. The South steadily rising there, and we should probably expect that to go for a little bit, but that will turn around hopefully in the next couple of weeks. All right, let's move on to developments because we've got a lot of things here. First up, we've got some breaking news that Johnson & Johnson released or is in the process of releasing its vaccine efficacy data, showing it was 72% effective in its trials in the United States. And the Johnson & Johnson vaccine trials were very interesting because they also were held in South Africa, where the more contagious B1351 variant is spreading there. Unfortunately, there, the efficacy was only about 57%. So it shows it was definitely less effective against that variant. It's worth noting, however, that a standard flu vaccine is anywhere between 40 to 60% effective. And these are just at preventing disease. Overall, the vaccine was 85% effective against preventing severe disease. So it is still good for presenting significant illness and death. It's less effective against preventing any kind of illness against the new variant. What's important about the Johnson & Johnson vaccine is that it only requires one dose, and it does not require the same level of deep refrigeration that the mRNA vaccines like Pfizer and Moderna need. So it's much easier to distribute. You can basically store it in a dorm room fridge if you need. But so that lack of the cold chain and the single dose only means that it's a much easier vaccine to get out to places that need it. So while it is not as effective as the mRNA ones, it actually uses a different platform than them. It is still another tool we have going forward. So it is positive. It's not as effective as like. They are actually looking at a second step vaccine to see what will happen in a two-step version of it with a second injection, and if that's going to be significantly better. And we may see results on that in a couple more weeks, but they should be applying for emergency authorization next week. Also on the vaccine front, the pharmaceutical company Sanofi is going to start manufacturing the Pfizer vaccine, promising to make 100 million vaccine doses of the Pfizer mRNA vaccine in the next year. This is a huge step towards getting more of the vaccine out there. It's also an unprecedented step of two basically competitor companies working together to produce the vaccine, just to show how much we need to get this out there. But another 100 million doses is huge. Also, recent studies showed that antibodies, another treatment that has been played with in the last couple of months, recently did not show great efficacy when used as a intravenous infusion. Is actually showing pretty good work as what's called a passive vaccine. Unlike an active vaccine, like the ones we've been talking about before, where your body reacts to a mock version of the virus and produces its own antibodies, this is basically an injection of existing antibodies. And this was shown to be effective in preventing disease, severe disease, basically given after exposure. Someone gets it just as an injection, not an infusion. So it could be done in an outpatient setting. You go into a regular doctor's office and get this the same way, in the same type of injection as an insulin shot, rather than having to actually have this infused intravenously. So that's an interesting possibility. Also, Boston is planning to relax some of its restrictions, moving up to step 1 of phase 3 of the reopening. This is bringing it up to the rest of the state, which is already at that point. This will allow reopening of places like gyms and movie theaters at reduced capacity starting February 1st. While these new venues are allowed, just people should remember to still take additional caution while case counts are falling. We know that the more contagious variants are out there right now, and the South African B1351 and the Brazilian P1 variants have both been confirmed in the United States. Now, this doesn't necessarily mean they'll take off. The initial coronavirus was thought to have reached the United States several times before it finally exploded outwards. But that said, these are much more contagious versions, so it is very easy for them to spread. And unfortunately, we do not do the genetic sampling on the scale necessarily really show us how far they've spread here in the United States. But that is something that we are bracing for. Despite case counts are falling right now, these new variants may make them spike back up in the near future if they take hold. And you can find the sources for all of our numbers, this presentation from the COVID Tracking Project, which makes all those graphs, New York Times for the raw numbers, and mass.gov for the Massachusetts statistics. And for more from the MassSupport Network, you can find us on our website or on social media. And remember, wear your mask, wash your hands, and we'll be here if you need us. Stay safe.